Oggi è un giorno particolare per Antonini Urology e oggi è un giorno davvero speciale perché abbiamo qui nel nostro studio il professor Steven Wilson. Il professor Wilson è il padre della protesica mondiale, è colui che ha permesso a decine di migliaia di uomini di risolvere il problema della disfunzione erettile, quando le protesi peniene erano considerate qualcosa di assolutamente ancora nuovo e sconosciuto. Il professor Wilson ha aperto alla protesica peniena ed è stato il maestro dei oggi più importanti chirurghi che ci sono al mondo. Tra primi il nostro carissimo e fraterno amico con cui collaboriamo, il dottor Paul Perito di Miami, di cui Wilson, oltre ad avere un'amicizia personale, è stato il suo maestro. Ecco, avere il professor Wilson qui nello studio del dottor Antonini è per noi due volte un piacere, perché soprattutto è venuto per un riconoscimento di grande importanza che verrà dato tra poco al dottor Antonini per la sua grandissima esposizione, il suo grandissimo lavoro a livello europeo nella chirurgia protesica peniena. Adesso rivolgerò in inglese una domanda al professor Wilson. Professor Wilson, I just said to our person that you are the history, you are the Pope, like Paul Perito call you, the Pope of the implant, the prothetic implant in the world. And today we are here, you choose to come here to give us the honor with Dr. Antonini. Which is your feeling to be here today in Rome in Dr. Antonini's studio?
You shouldn't call me the Pope. A better term is Godfather.
Il padrino, you're right.
Because I'm not quite so sacred. When you're in this business, you know, of operating on people's genitalia, it's not really celestial.
And what is your feeling to be here with us today?
Oh, this is a big thrill. I mean, I can remember coming to Italy in the 90s and trying to find some young guy like Dr. Antonini who would focus on prosthetic urology and really get good at it. And I never could really find anybody. I mean, I had several guys and they would get to about 20 penile implants a year, and then they would become fascinated by another aspect of urology. Absolutely. And they would lose interest. But Dr. Antonini has really grasped it. He's gone and learned the minimally invasive technique, which is probably the best for the patient in terms of getting over it quicker and learning how to use it faster, which is what every patient wants to do. They don't want to wait 6 weeks.
Right, and it's very nice. And latest in the last meeting in Chicago, the World Urological Meeting, has been very nice when you said that Paul Perito in USA and Gabriele Antonini in Europe, they are the two hands of the same body. You know, it's only the Atlantic Sea, which is in the middle. It's separate the two hands of the same body, the body of the excellence. And I would like that you express this with your fascinating words.
Well, these guys make it look easy. I mean, 10, 15 minutes and they're done, but it's through such a tiny little incision that it takes a tremendous amount of skill to be able to accomplish this, and because you can't even see the scar when they're finished. And most patients really don't have a lot of discomfort either, but that technique Dr. Perito has been teaching for at least the last 10 years, and it really, only a few guys, very few guys, really get good enough at it to be like he is. The rest of them, they kind of try it and then they go back to the easier way for them through the scrotum because the incision is much bigger.
I really wanted to thank you to be here and to be honor us with this great gift that you are giving to Dr. Antonini and to all the full organization of Antonini Urologists, because to be honored from such a serious, skilled and tremendous in terms of humanity and knowledge like you, for us is a touch of God. And I want to thank you for this, and you are welcome at any moment, and thanks to a person like you, we can be person like we are today. Thank you, Professor.
You're welcome. Thank you.
Thank you.